I think the program as a whole has been a success for our clinic and for our patients, and I would encourage other clinics and providers to look outside the exam room to see what else they could offer.
We found out by the self-knowledge test that we were kind of lacking in some of the areas in our teaching. We started to concentrate on certain areas, and then we started a beginner's diabetes class to help those people that are really struggling.
Our base is our volunteer base, so we have 450 volunteers. Every one of those volunteers buys into the mission, and they're coming here because they want to give back and help people that otherwise wouldn't have access to care.
They encourage you. We talk about everything from your A1Cs to the highs, the lows, how to eat right, things that I was never told before. And that's a big accomplishment in that, because I was done. My diabetes passed on from generation to generation, and my mother is 70-some years old. She knew nothing either. And all of the things that I'm learning, I'm teaching her. Her A1C and her stuff is better now. More active, more social. I didn't used to. I stayed at home and relied just on me. And that's the big thing, getting out there and learning that you're not the only one.
The data speaks. We've seen in the patients not only their physical outlook, but their emotional outlook. We've seen a big change. I have a patient in my weight class. He lives alone, and he's an older gentleman. You can see personality change from the time he walks in to the time he leaves.
We can talk with patients and explain why we're doing things, or why it's important for them to take the medications they've been prescribed, not just because there's a set of rules and this is the way you treat diabetes, but it's just important for them to understand why they're taking them. And when they do, then they do it. It just has to click with them about why it's important.
The pharmacist being involved, it's not only been good for us as a health clinic, the patients are getting just this special care. So in the clinical pharmacists, because they know these medications, they're supportive of this thought that we don't want to just give them a pill and send them on their way. We want to show them how to improve their health along with their medication. It gives you security that they're getting the best care possible.